yourself again.
Hi everybody, this is Patricia Saxon, one of the hygienists at Boulder Dental Arts. Mythbusters Day, we've gone through. We're going to talk about periodontal disease today. How do you know if you have it? Guess what? You need to come to us to find out. But there are a few things that you will notice possibly. Periodontal disease has been around for years. We used to call it pyorrhea, gum disease, but its true dental name is periodontitis. And over the last 20 years, we have really come a long way as far as knowing what causes it, how to get rid of it, what to do to treat it. In my 40 years, everything that I do for you sitting in this chair comes from 40 years of experience. And what I know is that periodontal disease is, the precursor to it is gingivitis. Gingivitis is 100% curable and is only in the soft tissues of your mouth. Your gums will look red. The little things between your teeth are called papilla. They will be swollen. They will be red. And typically, if you are brushing up underneath the gum, as soon as that toothbrush bristle hits up, they're going to go. We have thousands of capillaries in our gums, and when they're inflamed, just like any other itis in the body, that organ swells, and so do our gums. So how do you know if you have gingivitis? Take a look in the mirror. If your gums are red, if they're puffy, then more likely than not you have gingivitis. And what is that caused from? Plaque, which is accumulating every 20 minutes in your mouth whether you eat or not. How do you get rid of gingivitis? And is it curable? Absolutely. It's 100% curable. And again, you go back to gum brushing 101. So, we've talked about gingivitis. You are actually the one. We have a special treatment that we do here. It's called full mouth debridement. We don't ignore gingivitis because we absolutely unequivocally know that it's the precursor to periodontal disease. If left untreated, it will lead to periodontitis. So we're very active in treating gingivitis. When you're here, you will know it. We do what we call a periodontal evaluation. Especially all our new patients have them. Once a year, our recare patients get a periodontal chart, and if you happen to be one of our periodontal patients, you will have a periodontal evaluation every time you come here. So, treatment of gingivitis is done with a full mouth debridement and proper brushing. If, unfortunately, your gingivitis was not treated and it has now gone into periodontitis, how do you know if you have it? Again, you're going to probably see the same things. Papillae that are swollen, red gums that bleed if you touch them. But more importantly for us, it's imperative that people come in for the periodontal evaluation, which includes a panoramic x-ray, which will allow all of us to visibly see where is the bone level. Periodontitis is not curable. It's maintainable once it's been treated, and that's done with, again, gum brushing 101. It's not rocket science, people. This is so simple. But you have to, it's important to be diagnosed properly and find out what stage you're in so that we can tailor our treatment to you specifically. So, back to gum disease again. After the x-ray is taken, the panoramic x-ray is taken, we will do a probing. We take 6 readings on each tooth, 3 on the outside and 3 on the inside. The numbers 1s, 2s, and 3s are perfectly fine as long as there's no bleeding points. Bleeding points, they tell me that there's active infection in the gum, and we denote them on each tooth in any place that we see them. So, numbers 1s, 2s, and 3s are fine. Anything 4 to 12, and our probe goes to 12 millimeters. At about 7 or 8, we know that you're an advanced periodontal patient. But early detection is so, so, so important. So come in and let us do a periodontal evaluation for you. Those 4s and 5s and even 6s can be totally reversed. We can't bring back the bone level that you will have lost if you have periodontal disease. However, we can get the ligaments to heal up at a higher level so that you can manage at home on a daily basis the periodontitis that you have.